Welcome to Life IVF Center. We're excited to get to know you and hope to play a role in your fertility journey. Let's talk about how we can get you started to learn more about us and our services. There are two possible first steps to working with us at Life IVF. The Complimentary Consultation is a short, no-cost chat about your circumstances, treatment questions, and Life IVF overall. You may also choose to skip the complimentary consultation and start directly with our fertility evaluation. This step is required to starting treatment and includes a more thorough medical history and record evaluation, required testing, physician consultation, and discussion of treatment approaches and pricing. Once your provider calls you, they'll typically start with some questions about your overall health, fertility history, and goals in working with us. Then, the time is yours to ask questions about the treatment process, our program, and possible treatment approaches. The consultation will conclude by discussing the next steps of starting treatment. To prepare for your complimentary consultation, it's important to note that call times are not exact, so please allow a few hours before and after to receive your call. The clinician will start by asking some questions about your fertility history, so having a good sense of your timeline will help make that part more efficient. Lastly, think of key questions you hope to have answered. As a short call without detailed records, there are limitations to what we can cover. However, our providers will do their best. While many patients find the complimentary consultation to be a helpful first step, there are limitations to the format. Our providers won't have detailed medical records or test results to review, so we'll only be able to speak generally and will not be able to give you formal recommendations. Finally, our providers have medical training and do not work with billing and pricing, so they won't be able to discuss costs with you. Of course, we know pricing and costs are very important to many prospective patients. We hope patients understand that at this phase, it simply isn't possible to provide an accurate sense of pricing. During the consultation, we won't be able to take into consideration key details, such as what types of treatment you'll pursue, how many cycles may be suitable for your case, or whether you have relevant insurance or other coverage for your care. After your consultation, expect a call from our patient operations team within the next few days to discuss the process and basic pricing questions. To continue, they'll also help you prepare for the more thorough fertility evaluation and new patient orientation. From there, we'll work with you to complete the required tests and documents to safely begin treatment before moving on to enter a treatment cycle.